In previous classes already we have discussed Lamotrigine, Topiramate, Gabapentin and Pregabalin, both are almost similar drugs. Okay, these are used both in epilepsy as well as these are used in nerve pain, okay, or neuropathy. Particularly these Gabapentin and Pregabalin are drug of choice in diabetic neuropathy. Patient will develop nerve pain due to damage in the nerves. Okay, anyways, about that we'll discuss in detail. And we have Tiagabine, Vigabatrin, zonisamide, Levetiracetam, very commonly used drug. This is Levetiracetam and lacosamide. So these are newer drugs. Their mechanism and their chemical structure is not similar to other classes, and these drugs are having less adverse effects. Yaad rakh lo, they are having less adverse effects. They are having less drug interactions. Actually, phenytoin and carbamazepine and sodium valproate are, they are either enzyme inducers or enzyme inhibitors, but these drugs are not having that property. Okay, enzyme induction and inhibitory property. That's why these newer drugs are commonly used in hospitals. Now let us try to understand about each drug. First we'll discuss about Lamotrigine. See, Lamotrigine mechanism I want to explain first. These drugs are commonly used and these drugs are important as well. See, first point, Lamotrigine can be either used in single drug as monotherapy. Monotherapy, we say monotherapy. Single drug can decrease the patient's seizures. Sometimes what happens when patient is having seizures or convulsions, one diazepam will be given and one sodium valproate is given or phenytoin is added. 2 to 3 drugs are added to show synergistic effect. But here when Lamotrigine is given, Lamotrigine single drug can handle total convulsions and seizures. It can be given in single drug form as monotherapy, or Lamotrigine can be used or it can be combined with other drugs. This point you have to remember about Lamotrigine. Next, Lamotrigine mechanism I want to explain here. Very important. Lamotrigine mechanism is very important. See, first, remember, see, listen. It has 3 to 4 mechanisms. First mechanism of Lamotrigine. Lamotrigine will show sodium blocking effect. The first, see, same like phenytoin. Lamotrigine will delay or it will decrease the entry of sodium into the presynaptic or in the nerves. Actually, sodium blocking means they will delay the activation of voltage gated sodium channel. This is first mechanism. See here, I told already, phenytoin, fosphenytoin, carbamazepine, oxcarbamazepine, sodium valproate, Lamotrigine, Topiramate, zonisamide, lacosamide, all these drugs, what they do? They will prolong the inactivation of sodium channels, voltage gated sodium channels. Okay, so first mechanism is it will block the entry of sodium. First mechanism. Second mechanism, Lamotrigine, it also blocks high voltage gated calcium channels. Here I explained you. See what I told, when sodium enters inside, here high voltage gated calcium channels will be opened, and this through here calcium will enter inside the cell. So this is the second. Here the Lamotrigine will inhibit the entry of calcium inside the cell. It will inhibit here sodium and it will inhibit calcium as well. So it is having 2 mechanisms. That's why Lamotrigine can be used as monotherapy. I think you all are following me. Okay, Lamotrigine has 2 mechanisms. Okay, it will block sodium and it will block high voltage gated calcium ions, channels. Through that it will decrease the seizure effect in the body. Okay, now these 2 are the important mechanisms. Along with this, what it will also decrease the glutamate activity. Glutamate activity decrease, how it decreases is by sodium and calcium only, indirectly. Okay, so mechanism I think you understood. Now some important points I would like to add here for Lamotrigine. Yaad rakh lo, Lamotrigine, initially if we want to start Lamotrigine therapy, we will start with 50 mg start dose, and this after start dose every day we can go with 25 mg daily, 25 mg tablets daily, once daily. And the Lamotrigine has good tolerance property. This is one benefit point for us. Lamotrigine has good tolerance, 50 mg start, 25 mg once daily can be given. Duration of action is also very good. Twice, thrice or 4 times a day is not necessary, and the maximum dose per day is 400 mg. Very important point. We should not exceed 400 mg per day, and this 400 mg also it should be given in divided doses, 200 mg or 150 mg or 50 mg 3 times like that. So 400 mg should not be given. 400 mg at a time should not be given, and 400 mg per day should not be exceeded. Okay, this is important point about lamotrigine. Now see, lamotrigine, some important points I would like to tell you. When lamotrigine is given, always remember, I told one point, lamotrigine can be given as a single drug monotherapy, or it can be added with other anti-epileptic drugs. If other anti-epileptic drug is enzyme inducer, like enzyme inducers, what we have? Carbamazepine. Lamotrigine concentration can be decreased. When lamotrigine is given along with enzyme inducer, lamotrigine concentration can be decreased. Number one. If lamotrigine is given along with enzyme inhibitor, in enzyme inhibitors, what we have? In enzyme inhibitors we have sodium valproate. If lamotrigine is added with sodium valproate, what will happen? Lamotrigine concentration may increase. So when lamotrigine is given, if it is added with other anti-epileptic drugs, always try to see whether other anti-epileptic drug is enzyme inducer or enzyme inhibitor. If it is enzyme inducer, lamotrigine concentration can be decreased. If it is enzyme inhibitor, lamotrigine concentration can be increased. This is important point you have to remember. Okay, if lamotrigine is given along with enzyme inhibitor like sodium valproate, what will happen? Concentration increases and it shows some adverse effects. In that, lamotrigine has very few adverse effects. In that, sedation is very common. Ataxia, this is also very common, because this sedation, ataxia, headache, nausea, vomiting, all these are very common adverse effects with all other anti-epileptic drugs. Okay, along with these common adverse effects, yaad rakh lo, lamotrigine causes skin rashes. Very, very important point. Lamotrigine. How will you remember? Lamotrigine causes skin reactions. When lamp, when lamp falls on the skin, what will happen? It will cause rashes. Like that you remember, lamotrigine skin rashes. This is very important. If lamotrigine is added along with enzyme inhibitors like sodium valproate, definitely it will cause rashes. So you have to remember this skin rash along with lamotrigine. Lamotrigine can cause skin rashes. This is important adverse effects. So what important points we have seen about lamotrigine? Lamotrigine has two mechanisms. It blocks sodium channels and calcium channels. Number one. Its doses we have seen. Okay, mechanism we have seen, its doses. And yes, lamotrigine, when it is given along with enzyme inducers or enzyme inhibitors, that we have to check. It can be given as monotherapy or it is given as combined therapy. Common adverse effects you already know. Okay, and it is commonly used for most of the types of seizures. It can be used for generalized tonic-clonic seizures, absence seizures. In most of the seizures it can be used. These are important points about lamotrigine. Next is topiramate. Topiramate. Topi means cap. Okay, in previous class I told topi means cap. Okay, see, for topiramate you just try to see the different brands and different drugs. We have 25 mg, we have 200 mg, we have 100 mg, 50 mg tablets are also there. Okay, so for topiramate I would like to tell, first we'll start with mechanism of action. See, for topiramate we have three mechanisms. Number one, what it does, it will inhibit sodium channel entry, first mechanism. Second mechanism, same like phenytoin, valproate and all. Second, it will inhibit entry of calcium from high voltage gated calcium channels, same like lamotrigine. These both the actions are similar to lamotrigine. Okay, both are similar to lamotrigine. Third one, very important point, what it does, it will go and inhibit on the AMPA receptor. See, this is presynaptic nerve, postsynaptic nerve. When glutamate releases here, glutamate will go and fall on the AMPA receptor or NMDA receptor, right? Just imagine this is AMPA, AMPA. and this is NMDA. Glutamate falls on these receptors and it will cause propagation of seizures. This already we know. This topiramate will go and it will bind on the AMPA receptor. It will go and sit on the AMPA receptor as like topi. Okay, topi means a cap, head cap बोलते, head cap. Topi means head cap, याद रखो. I don't know in Gujarati and Hindi. Actually this topi is Telugu word, I guess. Okay, this topiramate will go and bind on the AMPA receptor, and what it does, it will stop the activity of glutamate. So through that it will decrease the actions of epilepsy, or it will decrease the actions of glutamate, and through that it will stop seizure effects. This is the third mechanism. So it has three mechanisms. Through these three mechanisms, same like lamotrigine, topiramate also can be used as monotherapy, or it can be used along with other anti-epileptic drugs. Same like lamotrigine. Lamotrigine and topiramate are newer drugs, novel drugs. That's why they will have some novel properties. Same like lamotrigine, topiramate has no drug interactions. Topiramate has no enzyme elevating or enzyme inhibitory property. These two important points you have to remember about lamotrigine and topiramate. Now for topiramate, very, very important point you have to remember. First point, we have seen three mechanisms. Second point, topiramate causes weight loss. Topiramate causes weight loss. Very, very, very important point. Topiramate causes weight loss. Jogging जाते time पे what we will do? While going to jogging, सिर पे टोपी लगा के जाते. Yes or no? While going to the jogging, we will wear head cap and we will go. So like that you have to remember. Topiramate causes weight loss. Important point. Third important point, it can be used as monotherapy or it can be used in combination with other anti-epileptic drugs. Next important point, topiramate can cause kidney stones. Kidney stones, important point. Same like sulfonamides. Sulfonamides करके we have some antimicrobial agents. When they are given, they will cause crystal urea. In the urine, it will cause crystals, and through that it will form kidney stones. In the same way, these drugs also can cause kidney stones. So when topiramate is given, we have to advise to take lot of water. Lot of water should be advised to the patient. Very important point these are. Weight loss, अगर कोई epilepsy में है, and along with epilepsy seizures, if patient is overweight, always you can suggest topiramate as a single drug because they are given in monotherapy also. And advise to take lot of water. This is very important point. And one more next point, it is used in epilepsy, in generalized tonic-clonic seizures, myoclonic seizures, and it can be used in migraine. It can be used in migraine as well as in alcohol withdrawal symptoms. Same like lamotrigine. So lamotrigine and topiramate are very, very important drugs. So let me repeat the points about topiramate. Topiramate has three mechanisms. One, it stops sodium channel, it stops calcium channel, and it binds on the AMPA receptor, sits on the AMPA receptor and stops the actions of glutamate. That is about mechanism of action. Next point, it causes weight loss, so advised in overweight patients. It may cause kidney stones, so advise lot of water. It may be given as monotherapy or it can be combined with other anti-epileptic drugs, depend on the patient's epilepsy or condition. Okay, and it can also be used in migraine and in alcohol withdrawal symptoms. This is another important point about topiramate. Okay, next is gabapentin. We have gabapentin and pregabalin. Gabapentin and pregabalin, these both the drugs, gabapentin and pregabalin, these both drugs, what they do, they will act like GABA. Yes, they will act like GABA because they are GABA analogs. And gabapentin and pregabalin, if we see the specific mechanism of action, what they do, they will block the high voltage gated calcium channels. Particular mechanism of action is they will inhibit the high voltage gated calcium channel. Just imagine this is presynaptic nerve, postsynaptic nerve. Here sodium enters, this is voltage gated sodium channel, and here we have high voltage gated calcium channel. Here it falls glutamate. Here we have AMPA and NMDA. Okay, and here we have GABA. GABA will release here. GABA will go and fall on the GABA receptor, GABA A. Barbiturate will fall on barbiturate. Benzodiazepine will fall on benzodiazepine, and it will decrease the actions of glutamate here. Glutamate has depolarizing property, whereas GABA has hyperpolarizing property. Anyways, now you see gabapentin and pregabalin both are having same, they may go and act on the GABA A receptor, or they will stop the calcium ions. Here it will decrease the entry of calcium through high voltage gated calcium ion channel. They will inhibit the high voltage gated calcium ion channel. This is the mechanism of gabapentin. I think you understood the mechanism of gabapentin. I am talking about the mechanism of gabapentin. That is done. Now you see about gabapentin, I would like to add some important points. Gabapentin is not only used in epilepsy and in seizures, they are used in neuropathy. Just now I explained you about neuropathy, okay, diabetic neuropathy and peripheral neuropathy, neuropathy due to injuries, neuropathy due to multiple sclerosis, neuropathy due to some autoimmune disorders. There are बहुत सारे conditions, okay. So yes, gabapentin occasionally it is used as second line treatment for partial seizures. It is used for partial seizures. In previous classes we have already seen brain, okay, in brain we have two lobes. If single lobe or a part of lobe is affected, it is called partial seizure or focal seizure, okay. So gabapentin is occasionally it is used for focal seizures or partial seizures. Although initially developed as anti-epileptic drug, mainly it is used for neuropathic pain. Nowadays, I mean today, as of now, gabapentin is not used for seizures, because for seizures we have so many other effective drugs, phenytoin, carbamazepine, sodium valproate, lamotrigine, topiramate, बहुत सारे drugs हैं, okay. So now right now currently we are using gabapentin for neuropathic pain. Actually it is enlisted under anti-epileptic drug only, but it is commonly used for neuropathic pain, that you have to remember. So because of its pharmacokinetic profile, because of its very low bioavailability and short duration of action, it is given thrice daily, okay, and it is having no drug interactions with other anti-epileptic drugs, same like pregabalin and gabapentin has no drug interactions, so they will neither be interacted with phenytoin or carbamazepine, okay. And yes, they are commonly used in neuropathic pain. And one more important point, their common adverse effects are drowsiness, dizziness, diplopia, ataxia and headache. Wherever patient has nerve pain, in those conditions we can suggest gabapentin. Gabapentin and pregabalin are very tolerable drugs, okay, toleration property बहुत ज़्यादा है इसका, unlike other anti-epileptic drugs. So based on their pharmacokinetic parameters you have to check. Actually gabapentin has short duration of action and pregabalin has long duration of action, okay. Or anything else is left, or let us discuss about Tiagabine, Vigabatrin and Levetiracetam. Tiagabine is another anti-epileptic drug. Tiagabine, Vigabatrin and Levetiracetam. I think my screen is visible to you. See, we'll go with the Tiagabine. Tiagabine, it inhibits the GABA into the neurons, thus increases GABA activity. See, in previous class I told there is one channel called GAT1, right? This GAT1 is inhibited by Tiagabine. Tiagabine, what it does? Tiagabine will inhibit GAT1. I will try to make you understand. See, this is presynaptic, postsynaptic, and see here GABA is releasing here, right? When GABA releases, GABA will go and act on the GABA receptor, okay, GABA A receptor. When GABA is released, what it does? It will try to come back. Every neurotransmitter will either try to reuptake back into the nerve or it will be metabolized in the synapse, okay. Here the GABA will try to come back into the nerve. It will come back into the nerve by one channel which is called GABA transporter 1 or GAT1. This drug, what it does, you know, Tiagabine will inhibit this channel. Tiagabine will inhibit this channel, and what it does? It will try to increase the concentration of GABA. It will try to decrease the concentration of GABA in the synapse, and it will increase GABA activity, simple. So what it is telling? It inhibits the uptake of GABA into the nerves and it increases the GABA activity. And Tiagabine is not commonly used as monotherapy. It is always given as add-on therapy for partial seizures particularly. So sedation and dizziness are common. These are side effects. Tiagabine अपन हॉस्पिटल में ज़्यादा नहीं देखते. Tiagabine is not broad spectrum anti-epileptic. Always broad spectrum anti-epileptic drugs, or duration of action should be high, or they should have 2 to 3 mechanisms. Those drugs are commonly suggested for epileptic conditions. Next one is Vigabatrin. Vigabatrin, what it does, Vigabatrin will try to inhibit GABA transaminase enzyme. In previous class I told, see here, when GABA is reuptaking into the GABA nerve through GAT1 channel, here GABA will be metabolized by one enzyme which is called GABA transaminase. GABA transaminase. If we inhibit GABA transaminase enzyme, what will happen? The GABA which is reuptaken will not be metabolized. So again GABA can be released back into the synapse. So this drug, what it does, Vigabatrin will inhibit GABA transaminase enzyme. GABA transaminase enzyme which is present in the GABAergic nerve will be inhibited and it will stop the metabolism of GABA. Simple. GABA metabolism is stopped. That is the mechanism of Vigabatrin. Same, Vigabatrin being a single mechanism drug, it is given as adjunct in partial seizures. Here for Vigabatrin, V yaad rakh lo, adverse effect. Vigabatrin causes visual disturbances. Sedation, confusion and psychosis are common like other anti-epileptic drugs. Vigabatrin, visual disturbances. Okay, this is important point you have to remember for Vigabatrin. Next is Levetiracetam, very important drug. Levetiracetam is very important drug. Phenytoin, carbamazepine and sodium valproate, how they are important? Likewise, in newer drugs, Levetiracetam is that much important. Its mechanism is not exactly known, but it is used in generalized tonic-clonic seizures, partial seizures and myoclonic seizures. What and see, for Levetiracetam, some advantages are there. Despite other drugs, I mean for phenytoin, for sodium valproate and for carbamazepine, they are having broad spectrum activity. I mean they are having 2 to 3 mechanisms, especially sodium valproate. So when we compare sodium valproate with Levetiracetam, Levetiracetam has less adverse effects, Levetiracetam has less drug interactions, Levetiracetam has less resistant property, and Levetiracetam also has good toleration property. It has good toleration property. That's why Levetiracetam is considered the safe drug, and that's why it is commonly given in most of the admitted patients in the hospital. हॉस्पिटल के अंदर किसी को भी स्ट्रोक आया, स्ट्रोक पेशेंट्स ड्यू टू hemorrhagic or due to ischemia in the brain, patient will develop stroke. So in all stroke patients, Levi करके आता है, Levetiracetam is the drug of choice. Levetiracetam, Lorazepam, Levetiracetam and Lorazepam are important drugs in hospital, because these are, see, when Lorazepam and Levetiracetam is given, no need to worry, because they are having less adverse effects, they are having less drug interactions. If phenytoin is given, carbamazepine is given, or if sodium valproate is given, we have to keep checking other drugs, because they may either increase the comorbid drugs or they may increase the concomitant used drugs. Concentration कम भी कर सकता है, ज़्यादा कर सकता है, those drugs. But for Lorazepam and Levetiracetam, they are not having that adverse effects and precautions to be taken. Okay, so Levetiracetam is very commonly used in the hospital. Now let us discuss about benzodiazepines and barbiturates. Already in previous classes we have discussed about benzodiazepines in detail and barbiturates. Detailed single lecture we have discussed. In benzodiazepines we have diazepam, we have lorazepam, very important drug. Lorazepam, diazepam and lorazepam are very important drugs. These are the benzodiazepines, lorazepam and diazepam. These are important because their onset of action is very rapid, and their action will immediately stop convulsions and seizures to the patients. Because of that, in immediate emergency conditions, benzodiazepines are very commonly used. And in barbiturates, what we have? Phenobarbital. Phenobarbital, previously we used phenobarbital, but due to its lethal adverse effects, we are not using barbiturates. We use benzodiazepines. Okay, so about barbiturates we will skip for today. We will discuss about benzodiazepines. See, in benzodiazepines we have diazepam and lorazepam. You should not forget these two drugs, very important drugs. As I told, diazepam and lorazepam are having rapid onset of action. That's why they are commonly indicated for emergency conditions, especially in status epilepticus. Okay, diazepam and lorazepam, as they are having rapid onset of action, they are used in status epilepticus. See, they are available in IV form as well. That's why they are used in status epilepticus. Intravenous diazepam is used in emergency treatment for status epilepticus along with status epilepticus. याद रख लो, diazepam is very important. Diazepam can be used in tetanus. It is used in eclampsia. Okay, eclampsia. What is eclampsia? Convulsions in pregnancy due to high blood pressure or due to hypertension. That is eclampsia. So in eclampsia, diazepam can be used, and it is used in febrile convulsions and sometimes drug induced convulsions also. Drug induced convulsions or drug withdrawal conditions. Even when patient is chronic alcoholic, if chronic alcoholic patient suddenly stops taking alcohol, what will happen? Patient will develop withdrawal symptoms. So in drug induced convulsions, that is called drug induced convulsions in that cases. And there are some anti-epileptic drugs. Upon stoppage of those drugs, patient will develop seizures. So they are called drug induced convulsions. And sometimes amphetamines, some CNS stimulants. Yes, Prajwal is asking what is febrile seizure. See, febrile convulsions are a type of convulsions which are seen especially in high temperatures or in high pyrexia. Fever बहुत ज़्यादा हो जाता है and patient in that conditions patient will develop convulsions. They are called febrile convulsions. Okay, convulsions due to some infections. See, sometimes patient will develop sepsis. Okay, severe infection in blood that may cause sometimes seizures. That is called febrile seizures. Sometimes patient with meningitis patient may develop sometimes febrile seizures. Okay, so that type of seizures are febrile seizures or febrile convulsions. Okay, yes. So benzodiazepines, one point you have to remember, they are drug of choice in emergency, they are drug of choice in status epilepticus, they are available in IV form. That's why they are used not only in epilepsy, tetanus, eclampsia, febrile convulsions, drug induced convulsions, all these conditions they are commonly suggested. So okay, so few other important points about diazepam. See, diazepam, as we have discussed, they are rapid onset, they are having rapid onset of action, and see, they are having short duration of action. This is important. Action is rapid, but the duration of action is just 2 to 3 hours. So whenever patient develops seizures or convulsions, immediately one injection can be given. Okay, hence repeated doses are required, especially for diazepam. Diazepam can be administered rectally in children. ये चीज़ याद रख लेना. You have to remember this. Rectal diazepam, we have formulations, rectal formulations बोलते. They are usually given in small children because small children can't swallow tablets. That's why they are usually given in rectal form. And next one is lorazepam. Lorazepam is very similar to diazepam. It is same. It is preferred in status epilepticus. One difference between lorazepam and diazepam is diazepam has short duration of action, whereas lorazepam has long duration of action. Diazepam has rapid onset of action. This is also having rapid onset of action. Main difference is diazepam has short duration of action, whereas lorazepam has long duration of action. That's why previously when I started epilepsy, I told lorazepam is commonly indicated for emergency conditions. Emergency में we can't say seizures कभी भी generate हो सकते. So when a patient is admitted in the ICU or in the hospital, seizures can be any time. So diazepam, whenever patient develops seizures, always for every 3 hours, every 4 hours, you can't prescribe or you can't administer diazepam. No, that's why what physicians do, physicians will give lorazepam whose duration of action is greater than diazepam. That's why lorazepam is commonly suggested, indicated, it is recommended in seizures, in status epilepticus, in all other seizures as we have discussed for diazepam. And one more advantage of lorazepam over diazepam is it is having less irritative effect on veins. When it is given through veins, it is having less irritation, it is long acting, and it can be given in absence seizures and myoclonic seizures as well. Okay, so these are important points you have to remember about lorazepam and diazepam. Diazepam and lorazepam are benzodiazepines which are used in emergency conditions in epilepsy. I think I will stop here. Remaining drugs अगर कुछ भी है तो we will discuss in the next class.